Hi, I'm Dr. Rahul. I'm one of the consultant neurologists at Continental Hospital. My special interest is in headache, vertigo, stroke, and multiple sclerosis. I'm very glad that we have started a specialist headache clinic here in Continental Hospital, which is a multidisciplinary team which involves neuropsychologist, neuropsychiatrist, neurosurgeons, and neuroradiologist. Today, I'm going to talk about migraine, which is a big problem all over the world. But overall, in 2016, as per the survey, there were 3 billion people suffering from headaches, out of which 2 billion people suffer from tension type headache and 1 billion people suffer from migraine. I would like to talk about the migraine, which is like typically it is a single-sided unilateral pounding type of headache associated with sometimes with nausea, relieved by vomiting in certain people, as well as they do have associated sensitivity to lights and as well as the sounds. And it is quite disabling headache which can last about few hours to whole day, as well as increased in severity while walking or with any form of physical activity. The reason why migraine happens in many people is genetic predisposition. Along with that, superimposed, they have external trigger factors or stimulating factors like lack of sleep or lack of food and various other trigger factors. The classical trigger factors are like lack of sleep, lack of food on the right time, strong smells, excessive sounds, and certain particular type of food materials like Chinese food material or red wine or dark chocolate, and various other trigger factors are being noted. And these trigger factors in people who have genetic predisposition, they tend to get migraines. Following this typical history of migraine and the trigger factors, based on that, the doctor will assess the patient, and if required, imaging scans can be done, either a CT scan or MRI of the brain. Particularly, there are two types of treatment. One is acute treatments, which includes various painkillers like non-steroidal anti-inflammatory drugs, and there are specific migraine treatments like triptans, which are being prescribed for the acute treatment. And for the chronic treatment, again, there are various medications which are available, where these medications are taken regularly for a course, minimum course of 3 to 6 months for prevention, particularly in the background, which are taken on a regular basis. And there are also newer treatments like biological agents as well as Botox treatment, which can be given in particular patients who are suffering from chronic migraine or migraine for a prolonged period of time or having more than 4 attacks in a month.